House Republicans are considering $2.3 trillion in Medicaid cuts as part of a larger deficit reduction plan, including work requirements to qualify. In February, a bill was introduced proposing work requirements for Medicaid eligibility. Adults aged 18 to 65 would need to work or volunteer 20 hours a week in order to qualify. These changes could lead to nearly 2.3 million Californians losing Medi-Cal coverage. That's according to a new study from UCLA's Latino Policy and Politics Institute. More than half are Latino. Researchers say they're working in jobs that don't offer benefits.
Almost 1.4 million Latino Medi-Cal enrollees are in these critical industries, such as hospitality, healthcare, and construction. And these jobs are often like low-wage jobs that, as I mentioned, like they don't necessarily come with employer-provided health insurance because these individuals work as independent contractors.
Arturo Vargas Bustamante is one of the authors. He says Latinos in low-wage, unstable jobs without fixed hours can make it harder to consistently meet the 20-hour weekly requirement.
So Medi-Cal is actually the one that comes as the insurance of last resource to cover these demographics.
Rick Kronick is a health policy professor at UC San Diego. He says work requirements won't boost employment, but will cause coverage loss, even for those who are working.
The evidence is clear that they result in people losing coverage for administrative kind of process reasons. The real costs of not having insurance, which is that people are sicker and that more people will die. And we might save a teeny bit of money because of that, but it's a very teeny bit.
That's why the Latino Coalition for a Healthy California just launched a bilingual social media campaign.
We started Salvavidas, our social media campaign, because Medi-Cal does just that, Salvavidas. It saves lives. It is such a key part of our safety net in California that it is our duty to protect it.
Ceci Aquino is executive director of the organization. She says the campaign is also about reminding lawmakers that the health of Latino communities is tied to the state's economy.
We're very proud to be the 5th largest economy in the world. That can only happen if our communities are safe and healthy.
The proposed work requirements are part of a broader push to cut federal Medicaid spending. It's backed by 8 California Republicans, including San Diego's Darrell Issa. Heidi de Marco, KPBS News.
Coming into our waters. And in fact, we are willing to. The president has shown a commitment both in the last administration he ran and this one to work with Mexico.